Good morning, friends. Today our topic is about the gluteal region. Uh, Hope you all are in good health, and please take care of your family, and also be cautious about this COVID virus infection because already there is a lot of community transmission going on in Hyderabad. So let us start our topic today, that is about the gluteal region. So the gluteal region, coming to the surface anatomy, superiorly this gluteal region, like the boundaries of this gluteal region are superiorly the iliac crest, where you can see in this orange color line, this is the superiorly the iliac crest will be there, okay, and inferiorly the gluteal folds which are there. So these gluteal folds at the lower limit of the round of the buttock are the inferior limits of this gluteal region. Laterally, it is bounded by the line joining the anterior superior iliac spine with the front of the greater trochanter of the femur. And medially, there will be a natal cleft between the two buttocks. So these are all the boundaries of this gluteal region. So coming to the nerve supply, that is the cutaneous nerve supply of the gluteal region. So this gluteal region is divided into like four quadrants, that is the upper medial, lower medial, and the upper lateral and the lower lateral quadrants. And also there is one region at the region of the coccyx, that is the medial region. So the upper medial quadrant, it is supplied by the posterior rami of the upper three lumbar nerves and the upper three sacral nerves. You can see this picture. See, these are the posterior rami of the upper three lumbar nerves, and these are the posterior rami of the upper three sacral nerves. So these are the two set of nerves which supply the upper medial quadrant of the gluteal region. Coming to the upper lateral quadrant, this upper lateral quadrant is supplied by the lateral branches of the iliohypogastric nerve and the anterior rami of the 12th thoracic nerve. So this upper lateral quadrant, it is supplied by the branches which comes from the iliohypogastric nerve with a root value of L1 and also the anterior rami of the 12th thoracic nerve. You can see this one, this is the upper lateral quadrant. So this upper lateral quadrant is supplied by, you can see this is the lateral branch of the 12th thoracic nerve, okay, and also you can see the lateral branches of the iliohypogastric nerve. So these are the two set of nerves which supply the upper lateral quadrant of the gluteal region. Coming to the lower lateral quadrant, this lower lateral quadrant is supplied by the branches from the lateral cutaneous nerve of the thigh. You can see in the diagram here, you can see the branches which are coming from the lateral cutaneous nerve of the thigh. These are the branches which supply the lower lateral quadrant of the gluteal region. And the lower medial quadrant is supplied by the branches which comes from the posterior cutaneous nerve of the thigh with a root value of S1, S2, S3, that too from their anterior rami. You can see in this one, this is the lowest one, you can see this one. These are nothing but the branches of the posterior cutaneous nerve, that to the anterior rami with the root value of S1, S2 and S3. And there is a small region of skin over the coccyx, that is in the floor of the cleft between the two buttocks, which is supplied by the small branches which comes from the lower sacral and the coccygeal nerves. So this is all about the cutaneous supply of the gluteal region. Now coming to the fascia of this buttock. There are two fascias basically, that is one is the superficial fascia and the second one being the deep fascia. The superficial fascia is thick and it is impregnated with large quantities of fat, which contributes for the formation of the prominence of the round shape of the buttock. Coming to the deep fascia, this deep fascia is continuous below with the deep fascia of the thigh. But in the gluteal region, this deep fascia will split into two layers to enclose one muscle, one big muscle of the gluteal region called as the gluteus maximus. So above the gluteal maximus, this deep fascia, a single layer of deep fascia, it will split to enclose the gluteus. It continues as a single layer that covers the outer surface of the gluteus medius, and it is finally attached to the iliac crest. Now coming to the muscles of the gluteal region. Please, in this diagram you cannot see the gluteus maximus, because unless until you remove the gluteus maximus you cannot see the undercover structures of the gluteus maximus. So the muscles which are seen are the gluteus maximus, first one, which is not seen here. The second one being the gluteus medius. You can see the gluteus medius taking its origin from the iliac crest region, and then underneath it you can see the gluteus minimus. Okay, and on the lateral side you can see the like here in the picture it is not there, but there is one muscle called as the tensor fascia lata. You'll be seeing it in the next diagram picture. And also piriformis muscle. This is the piriformis muscle. It is very clinically important because it passes through the greater sciatic foramen. Okay, and this muscle will divide the greater sciatic foramen into two compartments. One compartment is the one which is called as the upper compartment, through which the like few nerves and vessels pass, and also there is another compartment called as the lower compartment, which lies below the piriformis, that too within the greater sciatic foramen. And also there is another muscle called as the gemellus superior. This is the superior gemellus muscle, and you can see this is the inferior gemellus muscle. And also you can see one muscle which is coming from here. It is called as the obturator internus muscle. Okay, and also you can see the quadratus femoris. This big muscle is called as quadratus femoris, which is starting from the ischial spine, ischial tuberosity, and is coming to the greater trochanter of the femur. And there is another muscle called as the obturator externus. So these are all the muscles which are seen in the gluteal region. So I'll read them out again for your understanding. That is the gluteus maximus, gluteus medius, gluteus minimus. Then the tensor fascia lata, piriformis, the superior gemellus and the inferior gemellus, the obturator internus and the obturator externus, and finally the quadratus femoris. Let us see in detail about all these things. The first muscle, that is the gluteus maximus. This gluteus maximus takes its origin from the outer surface of the ilium, that too on the posterior surface of the sacrum, and also from the sacrotuberous ligament. After taking its origin, this gluteus maximus will converge, and then it goes down and gets inserted in two regions. One insertion is over the iliotibial tract. You can see this one. This is nothing but called as the iliotibial tract. Okay, and the deep fibers of this gluteus maximus will directly go to the gluteal tuberosity of the femur, which is seen here. And this gluteus maximus muscle is supplied by the inferior gluteal nerve. And the important action of this gluteus maximus is it helps in the extension of the hip joint and also the lateral rotation of the hip joint, and it maintains the extended knee joint in the same position. Now you can see this is the fascia which is covering the gluteus maximus, thin fascia, and this same thin fascia you can see when it comes towards the gluteus medius region, it is also covering this facial layer, is also covering the gluteus medius muscle here. And you can see this muscle called as the tensor fascia lata, which is seen over the lateral aspect, because you can see clearly this is a lateral view. So over the lateral aspect you can see one muscle called as the tensor fascia lata muscle. And this tensor fascia lata also merges with the iliotibial tract as the superficial fibers of the gluteus maximus. Now coming to the next muscle, that is the gluteus medius. This gluteus medius takes its origin from the outer surface of the ilium, between the iliac crest, posterior and the middle gluteal lines. And then you can see after taking its origin from this region, now it gets inserted over the lateral surface of the greater trochanter of the femur. And this gluteus medius is supplied by the superior gluteal nerve, and its main action is the abduction of thigh, and also it will tilt the pelvis down while we are walking, in order to permit opposite leg to clear the ground. Coming to the gluteus minimus, it takes its origin from the outer surface of the ilium, between the middle and the inferior gluteal lines. You can see this one. And it is also inserted over the anterior surface of the greater trochanter of the femur, while the gluteus medius was inserted over the lateral surface of the greater trochanter, but this gluteus minimus is inserted over the anterior surface of the greater trochanter. And both the gluteus minimus and the gluteus medius are supplied by the superior gluteal nerve, And this gluteus minimus also helps in abduction of the thigh and tilting of the pelvis while we walk in order to clear the ground for the opposite lower limb. Now another muscle of which is especially seen in the lateral aspect of the thigh, that is the tensor fascia lata. It takes its origin from the outer lip of the iliac crest, just behind the anterior superior iliac spine. You can see this one. This is the anterior superior iliac spine. So it is taking its origin from the outer lip of the iliac. This is the iliac crest. Okay, and here you will be seeing this is nothing but the anterior superior iliac spine. So it takes its origin from the outer lip of the iliac crest behind the anterior superior iliac spine, and then it passes downwards, and finally it merges with the iliotibial tract, where it gets inserted finally over the lateral epicondyle of the tibia. You can see this is not lateral condyle, not epicondyle. It's lateral condyle of the tibia. And this tensor fascia lata is also inserted just as is innervated by the superior gluteal nerve, as in case of gluteus medius and minimus. And the important action of this tensor fascia lata is the abduction of the thigh along with the gluteus medius and minimus, and also it assists the gluteus maximus in extending the knee joint. So this is a picture showing the origin of these muscles. You can see this one. This is the gluteus maximus, and then this region which is occupied by the gluteus medius, and just below it is the gluteus minimus, and now you can see the tensor fascia lata, which I was telling you. Okay. Coming to the ligaments of the gluteal region. The ligaments of the gluteal region, there are two important ligaments in the gluteal region. They are called as the sacrotuberous and the sacrospinous ligaments. The function of these ligaments is to stabilize the sacrum and prevents its rotation at the sacroiliac joint by the weight of the vertebral column. Coming to the sacrotuberous ligament, this sacrotuberous ligament connects the back of the sacrum to the ischial tuberosity. You can see this one. This is the sacrotuberous ligament. This is the sacrum, and you can see this is the ischium with the ischial spine and the ischial tuberosity. This is the ischial spine and the ischial tuberosity. So this sacrotuberous ligament, it is starting from the back of the sacrum, and now it is all these fibers are merging together, and finally which they get inserted over the ischial tuberosity. This is called as the sacrotuberous ligament. Next one is the sacrospinous ligament. This sacrospinous ligaments connect the back of the sacrum to the spine of the ischium. You can see again this sacrospinous ligament, it is starting from the back of the sacrum. Now it is traveling forward, getting merged up, and finally getting inserted over the ischial spine. So this is about the sacrospinous ligament. Now coming to the foramina, there are two important foramina in the gluteal region. That is the greater sciatic foramen. You can see this big one, and also there is a small one in between the sacrospinous and the sacrotuberous ligaments, that is called as the lesser sciatic foramen. This is the picture to show you like how this piriformis muscle is coming out through the greater sciatic foramen. Okay, and also this is the gluteus maximus. This is the cut part of the gluteus maximus, and you can see this piriformis is the landmark for the greater sciatic foramen, where it divides the greater sciatic foramen into two compartments. One is the upper compartment, which is giving space for the entry of the superior gluteal artery and the nerve, and this is the lower part of the piriformis, greater sciatic foramen, below the level of piriformis, which is helpful for the exit of inferior gluteal artery and vein. And also there is another nerve called as the obturator nerve. However, you can see a very big huge structure here, yellow colored one. This is most important structure called as the sciatic nerve, which is specifically coming from the lower part of the greater sciatic foramen, that too under the level of the piriformis. Let us see about these gluteal nerves. The superior gluteal nerve is a branch of the sacral plexus with a root value of L4, L5 and S1. It leaves the pelvis through the greater sciatic foramen or the notch above the piriformis. So you can see this is the piriformis muscle. Above the piriformis, this whole greater sciatic foramen is divided into two compartments with the help of piriformis muscle. One is an upper compartment and one is a lower compartment. So this superior gluteal nerve is coming from the upper compartment, wherein it leaves the pelvis through the greater sciatic notch above the level of piriformis, and it runs between the gluteus medius and minimus, and it supplies all these muscles. So it supplies, as I told you, three muscles, that is the gluteus medius, gluteus minimus, and the tensor fascia lata, and of course few fibers to the hip joint. And now if you see the inferior gluteal nerve, this is the inferior gluteal nerve. Okay, you can see this one. This is the inferior gluteal nerve. So this inferior gluteal nerve is also a branch of the sacral plexus, and it leaves the pelvis through the lower part of the greater sciatic foramen below the level of the piriformis muscle. And this inferior gluteal nerve, as you know very well, it supplies only one big muscle called as the gluteus maximus. This is a very clear picture. You can see this is the superior gluteal nerve. This is the piriformis muscle. You can see the superior gluteal nerve coming from the upper part of the piriformis, and from the lower part of the piriformis you can see various structures, that is nothing but the pudendal nerve, and this is the nerve to the obturator internus. And now you can see this is the one which is coming out, that is the inferior gluteal nerve, along with a big one called as the sciatic nerve. This is the sciatic nerve. Okay, and also you can see important structure one which is coming out, that is nothing but the posterior cutaneous nerve of the thigh. Now let us see the nerve to the quadratus femoris, a branch of the sacral plexus, that is the nerve to the quadratus femoris. And the nerve to the quadratus femoris leaves the pelvis through the lower part of the greater sciatic foramen, and it ends by supplying the quadratus femoris muscle and also the inferior gemellus muscle. Now the next nerve, that is the nerve to the obturator internus. It is a branch of sacral plexus, and the nerve to the obturator internus leaves the pelvis through the lower part of the greater sciatic foramen below the level of piriformis. It crosses the ischial spine and immediately re-enters the pelvis through the lesser sciatic foramen. So the nerve to the obturator internus supplies the obturator internus muscle and also the superior gemellus muscle. Coming to the gluteal vessels, there are two important gluteal arteries, that is the superior gluteal artery and the inferior gluteal artery, both being the branches of the internal iliac artery. So the superior gluteal artery is a branch from the internal iliac artery and enters the gluteal region through the upper part of the greater sciatic foramen above the level of piriformis. And this superior gluteal artery divides into branches that are distributed throughout the gluteal region. The inferior gluteal artery is also a branch of the internal iliac artery, but it enters the gluteal region through the lower part of the greater sciatic foramen, that too below the level of the piriformis. You can see this one. This is nothing but the inferior gluteal artery, and this is the superior gluteal artery. Okay, below the level of piriformis. Okay, it divides into numerous branches that are distributed throughout the gluteal region. Coming to the veins and lymphatics of the gluteal region, the inferior and the superior gluteal veins will follow the inferior and superior gluteal arteries into the pelvis, where they join the plexus of pelvic plexus of veins. Peripherally, the veins anastomose with superficial gluteal veins, which ultimately drain anteriorly into the femoral vein. Coming to the lymphatics, the deep lymphatic vessels of the gluteal region accompany the blood vessels into the pelvic cavity and connect with the internal iliac nodes. The superficial lymphatics of the gluteal region drain into the superficial inguinal nodes on the anterior aspect of the thigh. Now coming to the lesser sciatic foramen. The lesser sciatic foramen is formed by the lesser sciatic notch of the hip bone and also the sacrotuberous and the sacrospinous ligaments. As I have shown you just now, the sacrotuberous and the sacrospinous ligaments, they together cross each other, and also in front there is the bone, pelvic bone. All these three together, they will form this lesser sciatic foramen. These are the structures which passes through the lesser sciatic foramen. They are nothing but the tendon of the obturator internus muscle, nerve to the obturator internus, the pudendal nerve, and the internal pudendal artery and the internal pudendal vein. So you can see this one. This was the greater sciatic foramen. Now you can see the lesser sciatic foramen here. So you can see this one, the pudendal nerve. Okay. And again it is coming through this part, and obturator externus muscle, obturator internus muscle. Coming to the next important muscle, that is the piriformis. This piriformis takes its origin from the anterior surface of the second, third and fourth sacral vertebrae. You can see this one. These are the sacrum, because sacral vertebrae are fused with each other. They are not individual bones. So these piriformis will take its origin from the anterior surface of the second, third, fourth sacral vertebrae, and it is inserted over the upper border of the greater trochanter of the femur. Okay, this is the piriformis, and you can see the upper border of the greater trochanter of the femur. This is the point of insertion for the piriformis, and this piriformis is supplied by the anterior rami of first and second sacral nerves. The most important function of this piriformis is the lateral rotation of the hip at the level of, lateral rotation of the thigh at the level of the hip joint. Coming to the next muscle, that is the obturator internus. This obturator internus, it takes its origin over the inner surface of the obturator membrane and also the surrounding bones. So after taking its origin from the obturator membrane and the surrounding bones, it is inserted over the upper border of the greater trochanter of the femur. You can see this one, this is the obturator membrane. So from the whole obturator membrane and also from the adjacent part of the bone, this obturator internus muscle is taking its origin, and then now it is finally getting, slowly it travels and gets inserted over the greater trochanter of the upper border of the greater trochanter of the femur. And this obturator internus is supplied by the nerve to the obturator internus, which is a special nerve, and also the action is, it helps in the lateral rotation of the thigh at the level of the hip joint. Now the obturator externus muscle. This obturator externus muscle takes its origin from the outer surface of the obturator membrane and adjacent pubic and ischial bones. However, this obturator externus, after taking its origin, it finally gets inserted into the greater trochanter, that too at the level of the intertrochanteric fossa. This obturator externus muscle is supplied by the nerve to the obturator nerve or the nerve to the obturator externus, and the important action of this obturator externus is it helps in the lateral rotation of the thigh. Now two small muscles, that is superior gemellus and the inferior gemellus. The superior gemellus takes its origin from the spine of the ischium, and it is inserted to the upper border of the greater trochanter of femur and tendon of the obturator internus muscle. This superior gemellus is supplied by the nerve to the obturator internus, and the important action of this superior gemellus is the lateral rotation of the thigh at the level of the hip joint. There is also a muscle associated with the superior gemellus called as the inferior gemellus muscle, which takes its origin from the upper margin of the ischial tuberosity and is inserted to the upper border of the greater trochanter of femur and also the tendon of the obturator internus muscle. The important nerve which supplies this inferior gemellus is nerve to the quadratus femoris. The important action of this inferior gemellus is it helps in the lateral rotation of the thigh at the level of the hip joint. This is our picture showing both these different muscles, that is the superior gemellus muscle and also the inferior gemellus muscle. Now another big muscle, that is strong muscle called as the quadratus femoris muscle, which takes its origin from the lateral border of the ischial tuberosity. It is nothing but the lateral border of ischial tuberosity. Just now you have seen like where the sacrotuberous ligament will get inserted. So that is the origin for this quadratus femoris, and then this gets inserted over the quadrant tubercle of the femur. The nerve supplied to this quadratus femoris comes from the nerve to quadratus femoris, and the important action is lateral rotation of the thigh at the level of the hip joint. This is the muscle, that is nerve to quadratus femoris. This is the origin of the quadratus femoris from the ischial tuberosity, and it travels laterally and then gets inserted over the quadrant tubercle of the femur. Now the most important last and final nerve, that is the sciatic nerve, which is a very thick nerve which supplies the whole lower limb. So it takes its origin from the branches of sacral plexus, that is from L4, L5, S1, S2 and S3. It emerges from the pelvis to the lower part of the greater sciatic foramen, as we were receiving, which comes below the level of the piriformis muscle, and then it curves downwards and laterally, lying successively on the root of the ischial spine, the superior gemellus, the obturator internus, the inferior gemellus and the quadratus femoris, to finally reach to the back of the adductor magnus muscle. Here it is related posteriorly to the posterior cutaneous nerve of the thigh and also the gluteus maximus. And it leaves the buttock region by passing deep to the long head of biceps femoris to enter the back of the thigh. The termination of the sciatic nerve, it terminates by dividing into two important nerves called as the tibial nerve and the common peroneal nerves. The level of this division is variable. Usually it lies at the mid level of the thigh, but however, sometimes you can see these two branches right from the origin of sacral plexus. Coming to the branches, the trunk of the sciatic nerve supplies the hamstring muscles, the biceps muscles, semimembranosus, semitendinosus, and the adductor magnus muscle. So this is very important picture for you clinically. The better surface marking for the safe area of buttock injections, that is the gluteal injections, can be defined as that area which lies under the outstretched hand when the thumb and the thenar eminence are placed along the iliac crest with the tip of the thumb touching the anterior superior iliac spine. So this green colored shadowed part is the safe area where you can give the intramuscular injections. Now the last slide, that is the posterior cutaneous nerve of the thigh. This posterior cutaneous nerve of the thigh is a branch of the sacral plexus. It enters the gluteal region through the lower part of the greater sciatic foramen, as you have seen previously in the pictures, that is below the level of the piriformis. And it passes downwards on the posterior surface of the sciatic nerve and runs down the back of the thigh beneath the deep fascia. In the popliteal fossa, it supplies the skin of that region. Coming to the branches of the posterior cutaneous nerve of the thigh, there are gluteal branches to the skin over the lower medial quadrant of the buttock. There is perineal branch to the skin of the back of the scrotum or labium majus. And also there is a cutaneous branch to the back of the thigh and also the upper part of the leg. So this is all in detail about the structures which are there in the gluteal region. Hope you have understood this lecture, and if you have any doubts you can come back to us. And take care. Please do not step out of your home until it is